So Princess Cruises is one of the 8 cruise lines that Carnival Australia represents in the region. Carnival Australia is the largest cruise company in Australia. Yesterday, Coral Princess had a very successful first stop in Eden, where she was warmly welcomed by civic and business leaders who were very happy to see the return of cruising and the economic activity that it brings. Today, she is shaping up for another successful visit to Sydney as our guests get out and enjoy the CBD, the city, and support the rejuvenation of the CBD. It is also the first time a cruise ship has brought tourists to Sydney in over 2 years. I would like to acknowledge New South Wales Health and the support and the standing up for the protocols that they jointly developed with the cruise industry and the other eastern seaboard states. These protocols really have supported the resumption of cruising and the rekindling of the $5 billion a year cruising industry in Australia. These protocols were designed with the knowledge that Omicron cannot be stopped from any place where people congregate. They were designed to manage COVID on board a cruise ship. They were designed to ensure the safe operations of a cruise ship and the health and well-being of the guests, crew and communities that we visit. These protocols, that is why everybody, all the crew and guests are vaccinated. That is why anybody who shows COVID-like symptoms is tested, and our crew is also regularly tested. And that is why we have increased the medical resources on board the ships. More doctors, more nurses, and COVID medications. What else did I want to say? Now I've gone completely blank. I'm sorry.
Where do you go from here?
Where do we go from here?
Yeah.
Well, this ship goes up to Brisbane tomorrow.
So it leaves port in the morning?
She leaves port this evening, and she will go up to Brisbane and sail up to Brisbane.
Do you know roughly what time it's at?
She's leaving about 9 o'clock this evening.
Can you give us an update on the number of people on board?
I believe now the numbers are similar to what they were yesterday, so about 110, 115 crew, and we've had more guests test positive today as they've exited the ship. And we believe, and the health authorities have also said, that most of those guests probably brought COVID with them onto the ship when they embarked in Brisbane.
And that's people who tested positive on rapid antigens, that's before disembarking in Sydney?
Yes, that was part of the protocols that we worked through in collaboration with New South Wales Health. It's been a very collaborative relationship as we've worked through what are the protocols and how do they apply. I should say that these protocols, nothing here is new. These were all protocols that had been agreed in advance.
How many new guests? I'm assuming it's still majority crew?
Yes, it's predominantly crew.
So how many new guests roughly?
I think it's around about 10.
So does this indicate, Nova, that the protocols are working? You haven't seen rapid spread.
That is exactly it, Chris. This is the protocols working. It shows that we actually are able to very successfully operate cruise in a COVID environment. This is the only industry where we have protocols at this level. They are higher protocols, and we do embrace them. They give us the confidence to operate in a COVID environment.
So those 10 guests who did test positive upon exit, how would they then manage? They kept with the ship for some time?
We have onboard protocols, the protocols that have been, as I said, designed with New South Wales Health, where they go into isolation.
So they're tested on the ship under?
Yes, they would be on the ship.
If someone gets severely sick, what's the protocols they're on the ship?
If somebody does get severely sick, I can tell you that around the world that has happened extremely rarely because of the protocols, because everybody is vaccinated, because we test very early on, and we do have COVID medication on board. So in some rare circumstances we will disembark a guest, but most of the time we're able to manage on board. The crew that have tested positive, in most cases they're asymptomatic or they have mild symptoms, and after a few days they will come out of isolation.
We know that when the passengers want to disembark and enjoy Sydney and Eden yesterday, they have to take a rat test first. We had some comments from the passengers this morning getting off that nobody checked those rat tests. What have you got to say on that issue?
Well, two things. Firstly, that is the protocol that was agreed with New South Wales Health. It's a self-administered rat. But secondly, that is happening every day in Australia. Thousands of Australians are testing themselves with rat tests and then reporting them. So it really is the community standard, self-administered and self-reported rat tests.
So and that's the way it works here. So it's an honesty system. You test yourself before you get off the ship, and nobody checks, either from your crew or New South Wales Health.
We do ask, and we ask them to attest that they have done it, like anybody.
If someone gives a false attestation, what's the consequence?
If we find out they did give a false attestation, we will inform New South Wales Health.
People I've spoken to this afternoon seem to be pretty happy to be returning cruising, walking around, etc., etc. Is this just something that's to be expected and accepted if you're a person that goes on cruises?
Over the last 2.5 years, we've learned a lot about living alongside COVID, and I think for our cruise guests, they understand what it means to get back to normal life whilst COVID is still in the community. We informed everybody before they got on this cruise that we did have some cases in the crew, and the majority of them decided they wanted to cruise anyway because they love it.
You mentioned that there's been a lot learned over the last 2.5 years. What's been learned from the case of the Ruby Princess specifically?
Well, I think specifically all of that has gone into how we've developed these protocols, which really is, it's about that, but it's more about what else we've learned. Back in March 2020, we didn't know anything about COVID. Over the last 2.5 years, we've learnt a lot. We've learnt what works. We've learnt that vaccinations work against serious illness. We've learnt that masking works. And those are the protocols. That's the basis of the protocols that we use on Coral Princess.
You've worked so hard on those protocols and setting that up in collaboration with health departments around the country. But tell me how you were feeling when this vessel set off, and it was the first to be visiting Sydney. Were there some butterflies, were there some nerves to put that protocols, those systems you put in place? Were you worried?
No, because we'd been through a number of exercises. We knew this was going to happen. The health authorities knew that we would have a situation where we had, COVID on ships. No one expected that we were going to keep COVID off ship. It was really just about managing it, and we've been ready for this.
Can you tell us a bit about the crew? Were they on the ship before it departed Brisbane?
Yes.
But for how long?
I can't tell you specifically. We have crew
Weeks,
rotating.
months, days?
It could be all of the above. Crew are constantly rotating on and off the ship.
So they're rotating. So it's possible that one of them rotated on and then picked up into the ship.
It's also very possible that a guest, we know that a number of the guests who are positive today actually brought COVID on with them when they boarded in Brisbane.
It's 5 minutes, it's hard to get COVID in 5 days.
Okay.
Right.
Thank you very much.
Well done. Perfect.